Shaitanirrajim, Bismillahirrahmanirrahim. Assalamu alaikum and a very warm welcome to World This Morning. I am your host Hajra Satti and joining me is my wonderful co-host who happens to be Fahim Bangesh. Assalamu alaikum Fahim. How are you doing on 14th of June? That happens to be Friday as of today.
Okay, Walaikum Assalam first of all, and second of all, Jummah Mubarak to you
Mubarak.
and everyone who's watching us. And I'm very well, thank you very much, Adra. Thank you for asking. It's always very kind of you to ask how I'm doing, and I hope you're doing well.
Alhamdulillah. So, Fahim, today happens to be 14th of June 2024 and this is Blood Donor Day.
Yes.
And in order to commemorate the day, why do we observe that? Obviously, we are going to unpack this conversation. But before that, I would like to share few statistics that I gathered from the WHO website. And according to the website, there are 118.5 million blood donations that are collected globally. And out of that, 40% are collected from the high-income countries. And obviously, in low-income countries, up to 54% blood transfusion was given to children under the age of 5 years old. And this is a very staggering figure considering the fact that children under the 5 years of the age are suffering from the blood-related diseases, right?
Exactly.
And obviously, we are going to unfold the plasma-derived medicinal products and how they're unfolding and how exactly can we ensure safe and adequate blood supply to the patients, particularly when we talk about, as of today, that happens to be the World Blood Donors Day. And we need to appreciate all of those unsung heroes who are contributing, who are donating their blood. But obviously, we need to also take care of the safety and the precautions when we talk about the blood donations.
Absolutely, right? Hajra, you're correct. We need to take safety precautions, yes. But at the same time, we need to get rid of all the notions, the negative notions that people have regarding blood donation, that you should not, perhaps it will make you weak, perhaps the needles are not safe. I think we have enough safe areas where you can go and even take your own needles for that matter, packed needles, and you can donate blood because that will help you create more fresh blood cells in order for you to lead a more healthy life, in order for you to have a healthier immune system as per my knowledge. But of course, we will get into the details of World Blood Donors Day, why is it important and everything. And for that, I would love to introduce our first guest of the segment. And we have with us Air Vice Marshal Aftab Hussain Saab. He is Hilal Imtiaz Military, Sitara Imtiaz Military, and he also has knighthood from Geneva. Aftab Hussain Saab, Assalamu alaikum, good morning and welcome to PTV World.
Wa alaikum salam, good morning and thank you very much for inviting me.
And for our listeners, Aftab Saab has the honor of running the Sundus Foundation, and he is working very diligently on the cause of the World Blood Donation Day, and he is working for the thalassemic patients. And I think this is a very noble job of someone who wants to dedicate his time, his effort, his energy to take care of those underprivileged people who are particularly suffering from this blood conditions. Thank you so much, Aftab Saab, for your immense contribution towards our society, for making sure that thalassemic patients are taken care of. And the theme of this Blood Donor Day is 20 years of celebrating, giving. Thank you, blood donors. So, Aftab Saab, why do you think we need to observe this day and have the conversations that we are having today?
You have covered a lot in intro. I would just like to add the theme of this particular 2024 day. It's honoring the heroes of life. And it's a thankfulness to those who give their blood voluntarily and save the lives. This day is celebrated primarily to create an awareness about the blood donation, as you said in your introduction also. Secondly, to thank those heroes who have been donating blood. And thirdly, to encourage those who haven't done as yet, to recruit new donors and to make them motivated to give blood. And lastly, for those organizations and communities who are involved in that, to help the build up a very good blood supply chain. These are the purposes of this day.
So, Sundus Foundation has a huge name because I think every second person has heard about this. Yes. When did you start, start this organization? How did you come up with the idea? What motivated you to start this noble purpose?
This Sundas Foundation was founded by Munu Bhai
Right.
way back in 1998, and Yasin Khan, the present president of Sundas Foundation, and equally helped by Suhail Wadach, Khalid Abbas Dar, and Suhail Azizi, known as, of course, because they all were from the media, and Munu Bhai was a big name in
Yes.
art and columnist,
Literature, yes.
very good columnist. So they started, and it has been now over 2 decades. The Sundas Foundation has been working, and they have introduced 3 things. One, they changed the trend of commercial and paid treatment to free of cost treatment of the thalassemia and hemophilia. Number 2, we went from this family replacement donation to the voluntary donation. Our whole collection, which is around 30,000 per annum, is through voluntary camps in the universities, colleges, and individuals coming to our centers. And daily we transfuse 250 to 300 bags through 13 centers in various countries of Pakistan. So it has been a long journey. Sundas Foundation has done well, and I would urge upon others also, because if we go towards the need of Pakistan, we need 3 million, that is around 30 lakhs of blood bags per annum. Our population has reached 25 crores, and if 1 to 2% only start to donate blood regularly, the dilemma, the problem is that people do give blood voluntarily, but they are not regular. They do not give again. So we need to pursue them and keep reminding them that you are due. There should be a very good blood donation retention strategy to track the donors, active donors, also recruit new donors, as well as to keep reminding those who were deferred for some reason once, and then now they are fit to give the blood.
Also, you mentioned that many media personalities were involved as far as founding of this foundation is concerned. Is this the role of media in spreading awareness? Is this done on a regular basis, or is this done only on the World Donors Day, or for that matter, World Thalassemia Day, or the special days designated by the WHO? Because I think, like you said, people need to do this regularly. Maybe they do it just for fun one time, voluntarily for one time. Maybe they're with a friend and they go and do it just by getting motivated with a friend. But what about doing it regularly? Because obviously health is something that's precious, and a lot of people, mashallah, have it. And the young population in Pakistan is quite a lot. The percentage is quite high, right? So how do we make them do it? Should we make it a regular thing on the media? What's your opinion? Would you shed some light on that?
Touched my heart. I was to request you that let's hold this program regularly, if not weekly, maybe fortnightly or monthly basis, to enhance the awareness of benefits of blood donation. That is number 1. Number 2, we need to have, and we have started conducting seminars on the benefits of blood donation in the universities and colleges, and that is the place where we must reach out. Thirdly, we should have maybe a chapter on benefits of blood donation at the matric level,
Yes.
so that the students start to get aware that there are there is nothing wrong in giving the blood. The misconceptions like if we give the blood we will get weak.
Yes.
Number 2, the needle phobia, particularly for the girls.
Oh, yes.
The dilemma is that in Pakistan we have 52 to 53% of females now. The bulk of our population comprises girls, and unfortunately they are unable to donate blood because of 1, underweight, number 2, low HB, and number 3, the parents at times do not allow.
Yes.
So we must create an awareness, start with the benefits of blood donation. If you ask me, I can very briefly tell the audience that 1, it keeps you healthy. In any case, your blood is going to be wasted after 120 days. It goes out of your body through urine and the new blood is made. So before it is wasted, please donate it. You are going to save 3 lives because we have to make the components of the blood, and that is RCC, plasma and platelets. So 3 people are going to have lives because of your donated blood.
Right.
And how regular should one donate blood, if you ask? Because many people even don't know that. They want to donate, but then if they donate too frequently, that would actually create some weakness in the body.
And sir, I think we also need to talk about the blood safety, particularly when we
Yes.
talk about the donations, because obviously as a lay person, when we are requesting blood or when we are giving blood, so we are not aware of, you know, what are the precautions that we need to keep in mind. Obviously, we are not experts in the field. So as someone who you're working and you have a very profound changes, you induce very profound changes. So what should we take in mind when we are donating blood or if we are requesting when we talk about blood safety?
If you give blood, then the regularly the plasma is regained within 24 hours.
I see.
The red cells are replenished in 6 to 8 weeks, and the iron loss is gained in 6 to 8 weeks. So male after 3 months and female after 4 months is ready to donate blood again. And if you keep doing this regularly, the iron is shed off. This is the iron which actually causes heart attack, cancer. So if you donate regularly, the risk of cancer and heart attack is reduced by 80 to 88%.
I see.
Then you stay healthy. Last but not the least, it's an act of humanity.
True.
True.
Quran says कि जिसने एक इंसान को बचाया, उसने पूरी इंसानियत को बचाया.
True, true. Right.
And answering to your question,
Sure.
we have one shortage of blood in Pakistan. People do not come voluntarily. If you ask me, 12 to 13% is voluntary donation. 60 to 70% is family replacement.
Oh, yes.
Demand driven. Your relative, your friend is admitted in the hospital, and the hospitals demand that please come and give the blood, and that is why people start to give blood. 20 to 25% is a very, very serious thing to mention, and that is the addicts standing outside the hospitals.
Yeah.
And these blood banks who are selling out this blood as much as 15,000 rupees, 20,000 rupees per bag, and it is not healthy one also. It at times is expired also.
Okay.
I see.
And next to that shortage is, as she mentioned, is the non-screening and non-component making.
Right.
That is what, because the triple bag cost you much more than a single bag. So what we are doing is that we are just using single bags. We are not into the habit of making components. If we make, we can, you know, a person may not be needing whole blood. He may be needing only red cells, or maybe plasma, or maybe platelets. So lot of blood is being wasted by not resorting to component making in majority of the Pakistan hospitals. Then screening comes. If the blood is not properly screened from those diseases which can go inside the body with blood, and what are those? HIV, hepatitis B,
Yes.
Yeah.
hepatitis C, syphilis and malaria. So the receiver can have, in addition to thalassemia, cancer or anything, that disease also. Because again the economic factor comes in, that the people are reluctant to screen the blood because each bag costs around 4,000 rupees.
I see.
And they just transfuse the bag as they receive from the donor.
Now, also, we know about, like you just mentioned, the disease related to blood transfusion. Also, I wanted to ask, who are the people who cannot donate blood? For example, I know for a fact that people with infections should not be able to be donating blood at all. But what about people who are on lifelong medications, perhaps, or who are the other sorts of people who cannot donate blood?
And who can donate for that matter, right?
First, who cannot donate, or Pakistan unfortunately is a high prevalence as far as diabetes are concerned. hepatitis is concerned, and HIV are concerned. So these people are out of donation.
All right.
Then if somebody has a surgery in the last 6 months, he cannot donate blood. But after 6 months, he may become eligible to donate blood. Then anybody who is on antibiotic for 1 week, he cannot, but after that, he can donate the blood. Then the age limit is between 18 to 60. But there are people who are donating at the age of 70 and 80 also. It all depends on his physical health and the condition. As far as diabetes, if the patient is on insulin, then generally we don't. But if he is on medication, then we do take blood from that person.
And also, sir, there are certain people who are on psychotropic drugs, considering the prevalence of mental illnesses which is there in the society, not just society, in the world rather. So what about them? If the drug level, the psychotropic drugs are there in the blood, can they donate blood?
It's not healthy, and we don't take that blood. There's a proper medical checkup prior to donation.
I see.
The doctor goes through this all questionnaire which you are asking me, and after having satisfied him or herself, then only she or he clears the donor to donate blood. Now coming back to the who all can donate. One, the person who has eaten a meal, maybe breakfast, it should not be empty stomach.
Right.
Number two, his age is between 18 to 60.
Okay.
Then his HP is 12.5 plus
All right.
for females, and for males around 13. And his weight should be 50 and above.
Okay.
Right.
And the rest mentioned that he must have not been gone through any surgery, or he must not be on antibiotics. These all people are eligible to donate blood
And these tests are conducted at the
prior
site
to the
of-
prior to the donation.
Right.
Right. And
Right.
sir, one question that arises is especially for people who are donating their blood. So, in your experience, how does a person feel after giving blood? I'm talking about, in a more physical sense, what sort of sensations that should that person feel in his or her body when they are donating the blood?
There is no bigger feeling than service to humanity.
Yes, yes.
Today you will give blood to someone, tomorrow someone will give blood to you,
Right.
True.
for you and for your dearest ones. Secondly, that after giving the blood, one must take rest for 2 hours.
Okay.
If he is a smoker, he should avoid smoking for 2-3 hours.
Okay.
No long drive.
Okay.
And then that day, he or she must avoid heavy exercise. They should just go off this exercise and take a very rich and healthy food.
Okay.
And after a day, then they can lead a normal life and everything starts to come normal. But the feeling is that you will not be there maybe after 10 years, 15 years, who knows who has to die when, but your blood will stay alive in the bodies of the people you have been donating the blood for.
That's
And-
a
and-
beautiful way of putting it.
Yes.
Thank you so much for expressing that, and I think I should have asked this question in the beginning, but pardon me because it skipped my mind. But since you've served in Air Force and you're a very decorated soldier, you have so many gallantry awards to your service, what sparked your interest into, because Air Force is defense of the country, it's very different and very diverse sort of a field, and then coming towards particularly serving thalassemia patients. So is there any personal story behind it?
It's a very common question asked.
Of course.
In every interview I go on TV, that which one, 3 innings I had, one in the Air Force, second the Ministry of Interior as Director General, where I earned this knighthood award, and third is of course in 7 years with Sundas Foundation. I would rate the last one
Okay, that's amazing.
because the life, everybody lives for himself.
True.
The actual purpose of the life is to live for others.
True.
And it has given me a unique feeling, very satisfactory life. I don't use any drugs. I sleep very peacefully, and Allah has been very kind to give me this opportunity to serve this humanity.
And I think the best gift Allah Ta'ala can give you is A, health, and B, finding a purpose in your life. And I think you've done that.
Thank you very much.
It's beautiful, sir. Thank you very much for being a
Thank you
part
so
of our
much.
program and
Same
giving
here.
us your time.
Same here, and I hope and I pray that we have these programs not once in a year but more often.
Inshallah.
Absolutely.
Thank you very
inshallah,
much. Thank you very much.
Thank you.
Thank you so much, sir, for coming on our show
Thank
and
you.
for having this wonderful cross-pollination of ideas on the blood safety and the donations and what are particularly prerequisites for donating the blood. But when we speak of our physical health, obviously it's very important that we further reflect and ruminate on this Blessed Friday. So after a short break, we will develop further the conversation on the physical aspects of our health. So don't go anywhere. Good morning. Thank you so much.
Back to World This Morning with Hajra Satti and Fahim Bangish. Well, we were discussing a very lovely aspect before the break, and that was the World Blood Donors Day. And now we're coming towards something quite interesting and something quite close to my heart, because every now and then we hear people talking about weight loss. Weight loss has become something which is trending these days, and the trend never goes off. Everywhere you go, you'll be finding weight loss pakki, weight loss this, weight loss that. But right now, we're going to be...
Fahim, do you remember there was this marketing of that, belts that you need to wear?
Sauna belts.
Yes, yes,
Sauna belts.
yes.
Yes. How can I forget?
And they were
Of
very
course.
famous, and they had a very effective marketing. But I think we need to spell out some of the facts regarding the obesity in Pakistan, which is 23% of the population in Pakistan has been clinically declared obese. That is very concerning and a staggering amount, and which is nearly 1 in the 4 person in Pakistan is suffering from that. And particularly this percentage is very higher in urban center, where 62% are categorized in the category of overweight or obese. And obviously we need to unpack this conversation and dissect, and because there's a concept in Pakistan that the concept of obesity lies in the barometer or in the arena of being healthy and non-healthy or unhealthy, right? So people who are obese, they are considered to be more healthier. So we need to ask whether the malnourishment...
Which is so wrong on so many levels. It's wrong.
Yes, and we need to ask whether malnourishment or obesity is mutually exclusive concept or they can overlap, right? You can be obese at the same time, you can be malnourished, right?
Exactly.
But I'm not an expert in this field. We do have an expert in this field who is going to unroll these facts for us because he has coming from an authority and as he studied this subject particularly. So Fahim, why don't you go and introduce yourself?
Yes, we have with us in the studios Dr. Amjad Saeed, the consultant laparoscopic bariatric surgeon. Basically, that's obesity management. Sir, Assalamu alaikum. Welcome to PTV World and a very good morning.
Thank you. Assalamu alaikum. Thank for invitations.
It's a pleasure,
Right.
sir. It's a pleasure. Dr. Saab, weight loss is something that many people are interested in, right? So first of all, why don't you give us a little overview of what your surgeries are all about and how do you conduct them before we get into the detail of that?
And what are some of the leading causes of the obesity in Pakistan?
Yes. Actually, overall world, it is a leading cause of is a genetic and overeating habits, this obesity. But before I tell you, I want to tell what obesity is. So obesity, we will measure it by basal metabolic index,
Okay.
Right.
which is the height and the weight. And we divide it into obesity class 1, 2 and 3. And usually in an Asian population, it starts like 33 BMI. So actually this is a revolution by bariatric surgery, which is also called metabolic surgery, where we can address a lot of diseases which are interlinked with obesity. So precisely what persons need a surgery. So if it is obesity class 1, so he must have some comorbidities, like he has diabetes, hypertension, or if it is have no comorbidities, he must be gaining weight even he is doing exercise and diet.
And is it true, sir, when they say that obesity is genetic, and also the fact that some people are more prone to getting obese than the others?
Yes. Some are very prone to disease. Even some are even eating very well, and they are slim and smart.
Yeah.
You are right.
Right.
You are right.
Also, sir, when we talk about the surgery, obviously every surgery that we talk about does have its pros and cons, right? I mean, we know about the pros. Obviously, your overall image improves. You, I mean, look better. You feel better. I mean, your overall self-esteem grows.
Confidence grows.
Confidence grows. But what about the negative impacts?
Negative impacts, if you see, if we see this is a operation which is gradually developed into this arena, and number of operations has been this is like a sleeve gastrectomy, mini gastric bypass, or SADI-S and duodenal stitch were there. So these are evolved slowly, and this is the technology behind it. So every person has to be come and consulted for which operation suits him. This is very important.
Just like hair implant,
True.
which sort of a surgery would suit?
True,
Yes,
true.
Exactly.
yes. For example, if we do a sleeve where we this is a restrictive procedure, and we reduce the volume of the abdomen, stomach.
Yeah.
So one must not have a hyperacidity in a stomach, or he has not hiatus hernia. So similarly, this operation is a very simple operation and mostly done it, and so this is pros is that is very simple.
And
Con is that it may have a hyperacidity.
right, and I think we need to also unpack the conversation that I alluded to in our introduction, which is the concept of healthy versus unhealthy, right?
Yeah.
So in Pakistan, there's particularly this perception that if you are, I mean, physically big, I don't know for the lack of better word, so you are deemed more attractive, or this is a sign that you belong to more well-off background, right? And
Khate peete gharaane
yes,
se
khate
hain ji.
peene gharane se hain, right? So, and let's bring this entire concept into the equation with the obesity and the malnourishment. So, is malnourishment and the obesity, they are mutually exclusive concept, or they can overlap? You can be malnourished while at the same time you can be obese. So, what is your expert opinion on that?
Actually, obese is not malnourished, I think. Malnourished is when you have depletion of vitamins and vitamins like this. Actually, he has diseases. When you become obese, you have diabetes, hypertension, you have polycystic arteries, you have sleep apnea, you have arthritis. So all these addresses cause him a disease rather than malnutrition, I say. So this obesity disease, weight loss surgery, if you say simple weight loss surgery or metabolic surgery, address all these matters. And it ameliorate diabetes, ameliorate hypertension, ameliorate all type of disease, even very, it help in infertility also.
I see. Also, sir, you mentioned the increase in acidity after the surgery. Also, does it also cause any deficiency in any particular vitamins, the absorption of certain vitamins?
It depends which type of operation you are doing. If
see.
you are doing sleeve gastrectomy, in which we have reduced the volume of the stomach, it is very less vitamins are needed. But when we do a restrictive procedure and malabsorptive procedure, then we have to take vitamins for life. And
see.
you have to be followed up by the consultant.
And sir, now also let's talk about this particular phenomena. Obviously, we have seen that the obesity is on the rise, and when I quoted
Even
the
in children.
Yes, and when I quoted the statistics that in rural areas and particularly in urban areas, there's 62% of the population that can be characterized as overweight or obese, right?
Yeah.
Which is a very huge and a staggering number. So, in your opinion, what is something not right that we are doing which is causing this phenomena to rise? And I mean,
Because
just
one or
talking
two
the
generations back, everything was normal.
So,
Yes.
what's wrong that we are doing?
Actually, it is the ample amount of food, less activity. This is the main cause of the obesity and diabetes and hypertension, which is associated with the obesity-related diseases. And this is when we do some surgery, it is a change of everything. Diabetes ameliorated, and all the diseases are ameliorated very well.
Or also, Dr. Saab, one thing that many people have I would say, misconception that perhaps it's a misconception. I'm not sure. I want you to clarify it for everyone. That when you get this surgery done, you
Right.
can eat everything for the rest of your life without exercise, and you'll be fit for life without doing anything.
Actually, this
I think
operation,
that is the wish of every individual,
Yes,
right?
it so is.
there is some truth in it, but
Right.
not all truth. So, when we restrict or absorb, your weight reduce, but it also teach you. For example, if I will restrict your stomach, you eat less. So, and
So
then
automatically
in the first week when patient come back, he reduce weight a lot, so it motivate him, and gradually we tell him that this is a modification of your health
All
is
right.
very important. You have to do exercise, you have to modulate your diet.
Right.
So, this is very important, and operation also teach him. When you are restricted, so it teaches the patient also.
Right.
Right. And sir, what are the, I mean, if someone, an obese or overweight patient comes to you, what is that one particular, I don't know, for the lack of better word, point where you tell that patient that, you know, yes, you need to have a surgery, or no, you don't need to have surgery, you can work on yourself, right? And then you can become or tone down your body. So,
How do
what-
you get to decide?
Yes,
Yes, yes.
yes.
First of all, first of important is I have tell you before that if it is obesity class 1 without morbidity, we do not do operation.
Okay.
I
okay.
see.
So we ask him, change your lifestyle,
Okay.
reduce your weight, do exercise. But if it is number of attempts he is not doing, then we can consider it.
Right.
But if it is obesity class 1, he has morbidity, diabetes, hypertension, sleep apnea, arthritis, anything, we recommend him surgery. And depending the history, investigation, and examination, then we decide which operation suits him.
And also, is the bariatric surgeries done on children who are morbidly obese?
Yes, this is prevalent now. We are doing from 17 years to up to 65 years. We are doing it, but mostly we do sleeves for the younger patients.
And also, Dr. Saab, we have seen that when people lose weight, all of a sudden the skin sags, right? So, is there any treatment for that, or is this supposed to go? It's like a price you pay.
Actually, it depends upon the initial your weight,
I
like
see.
BMI. If you are super obese, you have a huge abdomen, naturally fat will go and your tummy will hang. So after you reach a proper time, in after 2 years when your BMI is normal, so we will consider tummy tuck or like this cosmetic procedure if you need it.
So 2 years is the time.
Yes.
And is there a surety? You said, okay, a lifelong you have to modify your dietary practices, right? Is that true?
Actually, gradually you will tuned by these operations, what you are eating, and become accustomed to those diets.
Because I can kind of relate to it, because there was one time when I got really addicted to Nimco, and that started
yes.
causing me a lot of
Yes,
acidity,
yes,
as a matter
yes,
of fact. Now, even if I used to eat a whole pack, and now even if I look at it or take one morsel or two, I cannot have any more.
And I think we need to also
So
talk about,
perhaps he's, you know,
There is
kind
one
of
thing
saying-
I want to add.
sure.
Actually, when we do a malabsorptive procedure,
Yeah.
actually we are excluding duodenal ileum segment, which changes all your metabolic problems. So it actually increases the sensitivity of insulin. It changes the lipid profile, and it is corrected the uric acid. And even one thing very important, patient comes to the surgeon, he says you have operated here or here, because his choices become changed.
I see.
For example, if some patient came, he says, I say this operation doesn't suit you. No, I want to do bypass because it is more aggressive procedure and I want to lose it for more time. But you don't, sleeve will help you. No, I want to do mini gastric bypass. I done, and later on she came, I don't like sweets now.
I see.
So
Right.
this is something metabolically changes in bypass procedures.
And sir, what are some of the post-operation precautions that a person who's going through this surgery needs to take?
First of a proper consultation,
Okay.
a lot of lab work, everything. We check the thyroid, we check the adrenal cortex, we do ultrasounds, we see the gallstones. So, whole body should be properly checked because it is a major undertaking we are going for.
Right.
So, nothing is, some patient even now they are pending, they have low cortisol levels morning, evening, and we shift them to endocrine. So, it is a multidisciplinary approach. So, I send to a gastroenterologist, we send to endocrinologist, and later on when we are doing post-op surgeries, we are involving our chest physio, physiotherapist, dietitian. So it is a top of in a good multidisciplinary hospitals needed for that.
Right. Also, Dr. Saab, fat freezing, liposuction, bariatric surgery.
That is actually liposuction or fat freezing. This is aesthetic procedures.
I see.
Bariatric surgery is a healthy procedure. It is actually weight reduction procedure. They are aesthetic procedures.
Right.
So liposuction is not a bariatric procedure.
So-
It is not a weight loss procedure. It is usually done in a type 1 of abdomen to reduce your fat. It doesn't help you
So, I mean, the rebound can be really quick through
because
liposuction.
it is only
or-
the fat cells we are reducing. It has no benefits on your health. Diabetes, hypertension, doesn't help. It is you are reducing fat in some
True.
segment of the abdomen or like this.
Well, sir,
Right.
thank you
Thank you
very
so
much. It was a very informative session that we had, because many people out there must be thinking about, you know, how to lose weight, how to do this, that.
Only my message is that one should be ready to consult properly,
Okay.
take all investigations, examination, cross-examination, and the selection of the surgery is very important. And last or least, that he should be operated in some multidisciplinary hospital which has a good anesthesia, good post-op cover, good multidisciplinary endocrinologist, gastroenterologist, or like other people which are involved in this. So this is the message
Yes.
it should be done.
And thank you so
Thank
much
you
for
so
saying
much, sir.
that. And obviously, a good and proper consultation are very much important when it comes to your physical health, because any investment that you make on yourself is always very rewarding. Thank you so much, sir, for
Thank
once
you very
again
much.
coming to our
Thank
show
you. Thank
and
you.
for shedding light and unpacking so many complex problems like obesity and its intersection with the diabetes and malnourishment.
Hajra, since diabetes is so common, hypertension is
Oh,
so
yes.
common
Oh,
in
yes.
Pakistan,
Oh, yes.
people might want to consider their options. There are options available now.
True.
You don't have to be on medications for the rest of your life. You don't have to have comorbidities for the rest of your life. You can be healthy. Now there are options.
True. And with that, we will bid you farewell. Until next time, it's a goodbye, Allah Hafiz, and
And good
good
morning.
morning. Thank you.
Thank you, Ji.